Good afternoon, everyone. Welcome to the weekly webinar. We're glad to have you all here today. As you likely just heard, we are recording, and the recording will be available for future watching as soon as possible. Thanks, everyone, for muting yourselves. If you have questions or comments during our presentation today, please feel free to use the chat function, and I will watch those and we'll ask our to answer questions as she is able to during our time together. If you need closed captioning, you can click on the More button at the bottom of your screen, and then there is a captions option for you to select if you choose. So with that said, we are very happy to welcome back for the third time this summer, Dr. Heather Wilkins. And she is a microbiologist, a biologist, and a neuroscience, and as I think I described at some point, a brilliant biomarker brainiac. Say that 3 times fast. So we're so happy to have Dr. Wilkins back with us. You can see her credentials on the screen. She knows her stuff, and so she's got her screen sharing. Dr. Wilkins, I will turn it over to you. Thank you so much for being with us once again this summer.
Thank you for having me. You guys are probably getting tired of me. So
Not at all, Heather, not at all.
oh, yay. That's good. Okay, so we're going to continue today talking about biomarkers. But today we're going to focus on some of the biomarker development that's happening here at the KU Alzheimer's Disease Research Center in one of our ongoing studies. But before we really get into that, just in case people were not here the last time I spoke, I wanted to give just a couple minutes of reintroduction of what a biomarker is. So a biomarker, just very generally, is a biological marker. It's anything we can measure to understand someone's health or disease status. So it could be a body temperature to tell us that you have a fever, you're probably fighting an infection. Blood sugar is a biomarker, especially for those who have diabetes, and blood pressure is a biomarker, which lets us know about heart health, just as an example. The Food and Drug Administration, or FDA, regulates biomarkers and the tests that are done, for testing these in clinics and hospital settings. And so they have developed these categories for biomarkers because, as I just said, biomarkers have a very, loose definition, very wide definition. And so these are the main categories that we're allowed to fall into when we're developing biomarkers. They can be diagnostic, do you have a disease, for example, prognostic, which can tell us how long might someone live with a disease, predictive, ask who might get a particular disease. Response is going to ask or tell us if a treatment is working. Monitoring, is the disease stable, worsening, or improving. Safety, is a drug treatment safe? And then risk, do you have a risk for getting the disease? I kind of highlighted and bolded some of these because these are ones that we tend to think about more. Predictive, because obviously if we could predict if someone's going to get Alzheimer's disease, that would be really helpful, and maybe we could intervene earlier. Response, is this treatment working? I'm going to talk a lot about that today. And risk, do you have a risk for getting the disease? Because that can also help us with predicting. And so these are things that, we've been really thinking about, how could we do this? Well, the first question we have to really ask is, what is our target? What are we going to measure? So I'm sure some of you who have been with the ADRC listening for a while, that we really are interested in mitochondria. So this is actually a picture of a mitochondria. This is what they look like. These are the parts of your cells that make energy. And so they're really, very important in just general health and your body having the energy that it needs to function. What's really nice about mitochondria is we can measure their function. We can also measure how many there are. And so this can tell us a bit about what might be going on in a disease process. So why would we want to measure mitochondria, understand them in Alzheimer's disease? Well, we know that they do not work well in Alzheimer's disease. We see this not only in the brain, but we can also observe changes in muscle tissue, in skin cells, in blood. And so we know that these changes are not just specific to the brain. And so there is a chance that we could measure changes, using a biomarker from blood, for example. In addition to this, there are a lot of clinical trials that are testing therapies that target mitochondrial function, either planned or have been completed or ongoing. Those can include clinical trials that are going to target things like diet. I'm sure a lot of you have heard of or maybe even been a part of the ketogenic diet trial. Some of you may have even done a Mediterranean diet. There are other trials going on for exercise. We've had a few of them over the past decade with the ADRC. There are also medication and drug trials that will target mitochondrial function. For example, we had one, CABA, which was using creatine by Dr. Matt Taylor. And that was a target to increase mitochondrial function. However, even though we have these clinical trials going on, we don't have biomarkers to determine if those therapies are actually changing mitochondrial function. And so this has been a pretty big project that we've been working on for almost a decade at this point, to try to get some biomarkers developed that can be consistently measured, and that we understand, what they're telling us. So, one of the first questions we always ask is, okay, so we have a target, we want to measure mitochondrial function, understand how energy metabolism is working. So then we start to ask, well, how can we measure it? We like to try to measure things in blood, if we can, because it's not as invasive. We can get, a decent amount of it, meaning we're not limited, like we would be with cerebral spinal fluid. People are off. I'm more willing to get a blood draw than a lumbar puncture. We've talked about this, right? And it's obviously a lot cheaper to have blood draws done than it is to have other things like neuroimaging with an MRI and a PET scan or cerebral spinal fluid. So we've been working really hard to develop these in blood. And when we think about blood, blood has a lot of different cell types in it. So we also have to ask, well, okay, so what cell types are we going to measure this from? In your blood, you have red blood cells, you have platelets, and you have white blood cells. And then even within the white blood cells, there are, many different types. They're all listed down here. I'm not going to waste your time and go through them. But essentially what we've been focusing on are white blood cells. And the reason why is because red blood cells, they don't have a nucleus. And so, they behave differently than a normal cell. Platelets don't have a nucleus either. And red blood cells typically don't have mitochondria either, whereas platelets do. And so really, you have to think about the biology of the cells. This is where the biology comes in for everything that we do. White blood cells have a nucleus and they have mitochondria, so it makes it a lot easier. They function similarly to how other cells in our body do. And so we have been largely measuring these things in your white blood cells. It's also important to note, though, white blood cells are they're part of your immune system. They are what is going to be fighting off infections. And so we really have to understand how these different, variables of if somebody has an infection is going to affect these biomarkers, or other things like if somebody has eaten a meal recently or is fasting, as well as what kinds of medications that they are on. Because even, some of the currently approved medications for Alzheimer's disease can affect these biomarkers we're trying to measure. So the next question that's really important is, great, so if you can measure mitochondrial function in the blood, does blood really reflect what is happening in the brain? Our short answer here is we do not know. And so this is where our current study is coming into play. We recently received funding from a nonprofit called the Alzheimer's Drug Discovery Foundation. And they fund studies that they're interested in investing in. And they also do a lot of clinical trials looking at novel therapies for Alzheimer's disease. And so they agreed that we could really use some biomarkers or measures to look at mitochondrial function, because there are a lot of clinical trials that are trying to, improve how energy metabolism is happening and improve mitochondrial function. So how do we answer this question? Well, as we kind of talked about the last time I was here, we're going to couple our blood-based biomarkers with neuroimaging. And so we're going to have participants complete an MRI, so a magnetic resonance imaging scan, which takes about 30 minutes to 45 minutes. In addition to an FDG PET. FDG stands for fluorodeoxyglucose. So what that is you would get an IV with a tracer that has essentially glucose that has a little bit of radioactive tracer on it, so that we can actually see it going into the brain. And what this tells us is how much energy the brain is using. It reflects metabolism in the brain, and it will let us understand how that energy metabolism in the blood reflects what's happening in the brain. And as I showed last time, we do know that in the individuals who have Alzheimer's disease, they have reduced glucose metabolism in the brain. So this is someone with normal cognition, and the areas that have red have higher glucose uptake and metabolism in the brain. So as you can see that there's less red in those with early Alzheimer's disease and those with advanced Alzheimer's disease as well. And so we know that this measure goes down in individuals who have Alzheimer's disease. We're also going to do, like I said, an MRI, which will tell us about brain atrophy, which is another thing that happens in Alzheimer's disease. So here our goal is to examine our blood-based biomarker in the context of these neuroimaging outcomes, to try to understand if what we're seeing in the blood does reflect what's happening in the brain. So I talked a lot last time about biomarkers ATN, which if you've been in our cohort or studies, you've probably heard of or had these measures completed. ATN stands for amyloid, tau, and neurodegeneration. So the other question that we need to understand is, how do these mitochondrial biomarkers compare with the standard amyloid, tau, and neurodegeneration biomarkers? So the short answer here is that we have some data on this, but not enough. And so this is another thing we're going to be looking at. We are going to measure amyloid, tau, and neurodegeneration biomarkers in the blood, in addition to our novel mitochondrial blood-based biomarkers. The good news here is that this does not require an additional blood draw in the study. So we just use the same blood, and that way we can really look to see how these biomarkers compare with each other. Now I have a table here. And it shows you different biomarkers. We have our mitochondrial biomarker, amyloid, neurodegeneration, and tau biomarkers, and then our mitochondrial biomarker coupled with that ATN framework. So area under the curve here is actually a way that we tell how good a biomarker is at differentiating between someone with normal cognition and someone who does not have normal cognition. And we want that number to be as close to 1 as possible, but anything over 0.9 is actually pretty good. And so what we see here is that our mitochondrial biomarker is performing better, at least in the study that we did recently, than our amyloid, neurodegeneration, and tau biomarkers in the blood altogether. And then when we combine the mitochondrial biomarker with those ATN, it improves it even more. And so in our biomarker development efforts, while we are working to develop individual biomarkers, we are also looking to develop maybe a combination of biomarkers that could tell us a lot more about the disease process in Alzheimer's disease and help us with being able to diagnose it, as well as answer some of those other questions about prognosis and risk, in addition to treatment, how someone might be responding to a treatment. So what does our study require? So there are 3 visits, potentially. So visit 1 is going to be consent and cognitive testing, and the cognitive testing is only done if it's not been done prior, within the last 12 months. So someone who might be in our clinical cohort study will not necessarily have to undergo cognitive testing outside of their normal cohort visits. We will need a blood draw though, and that will be in addition to any other blood draws that have been done. This visit is going to be completed at the KU Alzheimer's Disease Research Center in the Fairway Clinic, where we normally have all of our study visits. Visit 2 will be an MRI, and this is only if one has not been completed within the last 12 months prior to when the blood was drawn. So if someone, again, is in our cohort and has had an MRI within the last 12 months, they do not have to repeat this. But if you do need an MRI, this would be completed at Hoagland Biomedical Imaging Center on our main campus. And then visit 3 will be the FDG PET, so that glucose PET scan, and that will be completed at the Overland Park campus. The compensation for the study is $100 for completing all study visits. And if you don't need an MRI, it's okay. We still consider that as completing that study visit. So everyone will be compensated the same. So who do we need in the study? We need individuals who are 55 and older, have cognitive complaints or no cognitive complaints. We are asking that individuals who have been diagnosed with another neurodegenerative disease that is not Alzheimer's disease be excluded. So if someone has, for example, ALS or Parkinson's disease, they would not be eligible for the study. Individuals need to be able to have an MRI, meaning that they cannot have a pacemaker or other metal within their body, which is an important safety factor for the MRI. And you also need to be willing to complete all of the study visits, including the blood draw, cognitive testing, MRI, and FDG PET. So that's what we need. It's not very restrictive because we really want to be able to include, anyone who wants to participate in the study. And the more data that we can have, the better off we are in really understanding how these biomarkers perform. So what do we have so far with regards to data? We did do a short study about 2 years ago, developing some of these biomarkers in a small amount of people. And what we do see, this is one of our mitochondrial biomarkers that we call the Mitochondrial Health Index, or MHI. And it's important to know this is on a log scale, so even just small changes do reflect pretty big changes in how the mitochondrial functioning in the blood. And ND is non-demented, and MCI is mild cognitive impairment, and AD, of course, is Alzheimer's disease. And what's really interesting here is that we do see a reduction in that mitochondrial health score in individuals who have Alzheimer's disease. We're not seeing that in the mild cognitive impairment group. And that, is interesting because everyone who has mild cognitive impairment does not necessarily go on to get Alzheimer's disease. And so, that's a very unique group to look at. And since these were people who were in the cohort, we can continue to look to see how their memory scores continue to progress over time. And look to see if this biomarker, for example, might predict people who might convert to Alzheimer's disease or people who may not. So these are the types of things that we're doing, especially, in our cohort study. We're able to ask these types of questions because we are following people for a very long time. And so we appreciate everyone who's taken part in these types of studies and anyone who, is interested in taking part in this study. You do not have to be in the cohort to be in the study. And so we hope that if you're interested, that you will reach out to the KU Alzheimer's Disease Research Center and see if you are eligible. And from that, I will take any questions anyone has. So looks like there's some in the chat, so let me open that up.
Thank
All
you,
right.
Dr. Wilkins.
All right, so Peggy is asking if someone with Alzheimer's could be included in the study. Yes, we are asking that people have a study partner, especially because we always take into account if someone is able to consent for themselves. If they are not able to, then we are allowing a surrogate to consent on their behalf. So yes, if people with Alzheimer's disease are needed for this study. How long does the MRI take? Asking because I do not like them. Yeah, understand. It takes about 30 to 45 minutes. We're doing, actually, it's not a very long scan in the grand scheme of things. You don't need an IV for that. And so it's about 30 to 45 minutes at most. The FDG PET, though, however, as I said, will require an IV because we do have to inject a radio-labeled tracer. So Pat is asking, what is the cohort? So the cohort is a study that we've had ongoing for almost the last, I don't know, like 15 years, over 15 years. Yeah. And so it's a group of people that come in every single year. They usually have blood draws, they have MRIs, and they have cognitive testing. And we follow them. We call it an observational study. And what it does is it allows us to really understand, how people might, how their cognition might change over time, what factors might influence cognition. It allows us to do these types of biomarker studies as well, because we can, they're participating in other research. They may already have some of these measures done, and so it reduces the need to repeat those types of measures. But if you're interested in learning more about the cohort, it does look like Kelly put in the phone number for the KU ADRC that you can call to learn more about that. Okay, and Bruce is asking us, how long is the study and will testing be repeated? So the study time, it can vary only because we're working around the scheduling with MRI and the PET scan. So really, it's just 3 visits. However, it could be a couple weeks between visits. It could be up to a month between visits. It really depends on when we are able to get an MRI and a PET scan scheduled, and that we're really working with the hospital side on that, because we have to, work within when those essentially when the PET scan and MRI are available for those. Will testing be repeated? Not at this time. However, what our goal is with this study is to complete this within 12 months. And then we will be reporting back to the Alzheimer's Drug Discovery Foundation. And if we are successful in completing the study within 12 months and we have strong data to show them to support these biomarkers for further development, we're hoping that they will invest more in our efforts and that we will be continuing to enroll people as well as repeating the testing, because we think that that is another important question that we should be answering next is, how do people change over time? So Pat is asking, how does the radioactive tracer get removed from the body after the PET scan, and how long does that take? And how and when do we get the results of our own testing if we decide to be a part of the study? So radio-labeled tracers usually are going to be removed from your body through your kidneys, so through your urine. I don't know how long it lasts or takes, but I wouldn't think it would take more than a couple of days. And then how and when do you get your results? So for this particular study, unfortunately, we are not giving results back because it is research-based, and we do not, we couldn't tell you what the biomarkers mean medically at this point. And so if we gave you the information back, it wouldn't necessarily help with healthcare purposes at this time. However, there are some disclosure studies going on for cohort where we do give back certain measures like cognitive testing, ApoE genotype, the amyloid tau and neurodegeneration biomarkers, MRI results, things of that nature. We do take special precaution, though, that none of the information from this research study will wind up in your medical record, because we since we can't say for certain what the results mean, we don't want it winding up in your medical record and potentially, going back to, for example, a health insurance company. So, answers that question, hopefully. Are there any other questions? Happy to answer. Very great questions.
All right. Oh, one more just came through.
Okay, so Bruce is asking, if we call, what do we ask for? So you can ask about the mitochondrial biomarker study. We're calling it mitochondrial biomarkers in Alzheimer's disease. The short name is MAD, M-A-D. Okay, and so Peggy is asking, since it's cleared in the kidneys, is there a possibility of kidney damage? So there have been a lot of people who have had PET scans with these radio label tracers. There's always a risk. However, that risk is pretty low. As with anything, even getting a blood draw, there's a risk to that. Getting an MRI, there's a small risk to that as well. And so it's just something to keep in mind. If you're not comfortable having that, then you do not have to participate it. Need a different acronym. Yeah, that was the best we could come up with. Happy if anybody is better at making acronyms. Would love to hear ideas. I'm gonna going back to the radio label tracers. There's always a risk to them. And since this is not something that, you have to do, it is your personal choice. And if you want to speak with maybe your healthcare provider about the risks and benefits before deciding, please do. Because we want people to be comfortable with doing the study. We don't want them to feel like it's something they have to do. So maybe we should have a contest with this group where we have new studies and they help us name them, because I feel like we could use some help with that. Yeah.
Dr. Wilkins, I love that idea. We'll keep that in mind. Maybe it could be a brain booster or something
Come up
one day.
with the best acronyms for studies.
That's great. I'm sure we'd have to make sure it was IRB approved, all that official stuff. But yeah, what a fun
the IRB doesn't really care about the name of the study. They don't. No.
I remember
they really don't
training
care.
videos on ethics and compliance with IRB, and I would not want to do anything that was not okay.
Yeah, I don't know.
So
I don't know. Could we crowdsource naming a study? That's a good question. We can ask them that.
It's a thought. Maybe we could just do it internally, just for fun.
Just for fun.
So I will keep that in mind for future issues of My Alliance. And I have a question, actually, Dr. Wilkins.
Yeah.
As everybody who gets My Alliance knows, we typically feature one of our currently enrolling research studies in issues of My Alliance. Are we good to maybe highlight some of the things that you talked about today in an upcoming issue for this study?
So, we have some flyers that have been approved through IRB.
Okay.
So I think we could share those with you.
That would be great. Okay. Well, stay tuned, everybody. We'll have that in an upcoming issue of My Alliance. So if you're interested in going mad, you can check it out. Give us a call at the number that's listed in the chat. And if there's a web link, we'll include that as well.
Yeah.
So with that, Dr. Williams,
maybe I'll have to use Chat GPT to come up with some better acronyms.
Oh, goodness. That might be a plan, although I think your intelligence is far superior to artificial intelligence.
I don't know. I'm not very good at coming up with acronyms.
Cool. All right. Well, thank you, everyone, for being with us today. Thank you, Dr. Wilkins.
Yeah, thank you for having me again. I'm happy to answer any more questions if anybody has them in the future. So thank you.
Very good. All right. So that wraps us up for today. 2 things coming up I want to make sure are on your radar. Next Thursday, of course, we will meet again for the webinar, and I will be your speaker, and we will be talking about Medicare and Alzheimer's disease. And the subtitle is Uncovering What is Covered. And that has arisen from a few recent webinars that we've had, as well as the family series, which just concluded. And folks are asking, you know, if I have this diagnosis and I'm thinking about anything from medication to long-term care, and I have Medicare as my insurance, what does that look like? So we'll talk about that next Thursday, the 15th. And then everyone who subscribes to my Alliance should have received the announcement of our upcoming hybrid weekly webinar on Thursday, August 29th. We had such a great time with an in-person weekly webinar in April. We thought we'd do it again. So that's coming up on Thursday, August 29th. It will be at 2 o'clock. On that Thursday, you'll be able to join us in person if you're in the area at our Fairway Auditorium on Shawnee Mission Parkway, or you can join on Zoom as you always do. So either one, we'll have refreshments for the people that come in person. And our speaker is a local author, a Kansas City author named Sonia Jury, and she has written a book called Mom Forgot My Birthday, A Daughter's Journey Through Alzheimer's Disease. I've read it. She gives a lot of great resources about her experience with Alzheimer's disease in Kansas City. She's got some great fun stories. And as she always says when I've talked to her, her book is about what not to do when you're a caregiver for Alzheimer's disease. So we hope you will join us. We'll continue to put that information in my Alliance newsletters ongoing. And we'll plan to see you next Thursday and hopefully every Thursday. Everybody have a great weekend. Bye-bye.